Good morning, everyone, and welcome back at ECCMID TV Live. I'm very happy to announce that live here in the studio with me here in Cologne, Germany, I have a new guest with whom I will be talking to. This is Annelies Zinkernagel, Professor of Infectious Diseases and Hospital Epidemiology in the University Hospital of Zurich in Switzerland, but probably better known to many of our viewers as the President-elect and Secretary General of the Executive Committee in Eskmed. So a warm welcome to you, Annelies.
Many thanks.
Happy to have you here in the studio with us.
Thank you.
How are you enjoying your ECCMID so far?
Very much. It's a virtual happening, so I'm missing all my colleagues and interacting on a daily basis, but I'm enjoying the talks tremendously. There were beautiful talks, very insightful, and that I have enjoyed very much, but I am looking forward to meeting everybody again in person next year.
I can imagine, yes. What is your personal specialty interest?
So what I really enjoyed was the Young Investigators Awards that we had that took place. We actually had 5 awardees this year because we took them together from 2020 and 2021. And what I found was quite striking was one of the awardees, which we had elected in 2019, was on mRNA vaccines. And at that time point, we had no idea how it would be changing our life. So it was really beautiful seeing this presentation by this excellent young scientist and hearing all the new things about mRNA. So it just shows sometimes we do really have a vision and take it forward. Yeah. Another talk that was of an awardee of 2021 was about SARS-CoV antibodies and lessons learned. So that was obviously very timely, and I enjoyed those sessions very much.
It's striking how time catches up, right?
Yes.
Yeah, like we almost had anticipated it, but yeah, we know it's different. So, any other sessions that have particularly caught your eye, or
there was? Yes, there was one yesterday on virulence, a very open question. What does virulence really mean? And Arturo Casavadell gave a beautiful, very insightful presentation, taking us through times from the dinosaurs to nowadays, the role of mammals and fungi, and I really enjoyed that presentation a lot. And it was a lot of food for thought, and that I think is one of the beauties at ECCMID, that we also have time to think about things and take it to the next step.
So has the term virulence, wow, it's a hard one. Has it been crystallized now, or is it still a term that is in process?
It is still a term in process. I mean, it's one of our favorite terms we always talk about on a daily basis, and I think he did a really good job on really reflecting how should we be thinking about these factors and how does it also drive evolution. So I really enjoyed that talk.
Great, great. Was there also a session on endocarditis, I think you were very interested in?
Yes.
Could you tell us a little bit more about that session?
So, I mean, endocarditis is a huge problem. Still, a lot of people die of endocarditis, and they're one of the main aims we have, as in almost everything in infectious diseases, is to prevent the disease. I mean, this is what we're currently living with COVID, trying to prevent the disease, and the same holds true for endocarditis. So there were 3 beautiful talks discussing the pathology of endocarditis, but also how could we prevent it and what leads to endocarditis. And I really enjoyed that because they were looking into ways how we could optimize the health of individuals in order that they do not succumb to endocarditis. Not only was it this preventive measures on the overall scale, but also looking at should we use other implants, for example, which are less susceptible to infection, and taking this more holistic view, which I really enjoyed about the endocarditis session. Yeah. Yes.
So other types of implants, but what was one of the other preventative measures that was highlighted as most likely to be successful?
Good oral hygiene. So that we really ask our patients who are at risk that they really take good preventive measures. And I think that's something that is often forgotten, and it should be repeated more and more. And so I thought that was a very important information and should be spread overall.
Absolutely, and oral hygiene is an easy measure also for people to do. So it's maybe a quick win.
Yes.
Yeah. Talking a little bit more about your upcoming presidency of ESCMID, how are you looking forward to that, or preparing for it even?
at the moment, I think it's difficult to prepare for anything in infectious
true.
diseases. We're just struggling with the moment. We thought we would have a bit of a break now with COVID-19. And as of the moment, the numbers unfortunately are rising again, not only in Europe, but also in other parts of the country. And we're dealing with a really big problem there. So I think at the moment, what we're trying to do is further strengthen the measures we have been coming up with, the preventive measures of social distancing, wearing the masks, and top of all is the vaccination. And if we can pull through with these and somehow get back into a steady state, then we will see each other in person in Lisbon, which I'm looking forward to very much, and hopefully also speaking about other pathogens in addition to SARS-CoV-2, which is at the moment really dominating our lives. Yeah. So I'm really looking forward to heading Eskmed and be part of ECCMID Live again next year. I think this pandemic has showed the importance of us as infectious disease specialists in diagnosing and treating infection diseases as COVID-19, but predominantly also the necessity of excellent diagnostics, which we need our clinical microbiology friends in order to really have a rapid diagnosis of a disease, which was incredible what they did. And so I think this has further brought us together and combined the best of two worlds. And so I'm really looking forward to further dwelling on this combination and also pushing preventive measures. I think also vaccination, which for a long time was a bit frowned on, people were very hesitant to vaccinate, has seen a new era. People have realized that this also gives us freedom. And I think if we can further convince people that really vaccination is saving lives, not only for COVID, but for the simple diseases like measles, for example, I think we have gained a lot despite this crisis. And I'm looking forward to further pursuing those approaches. Yes.
Yeah, well, so ESCMID and ECCMID, also the organization for this year's ECCMID, has shown a tremendous amount of flexibility, adjusting to a situation they were not prepared for, I think.
Yes.
Yeah. How are you looking at the future? I hear you saying that you're hoping to meet everyone in Lisbon. Are you trusting that that will happen, or will we have to lean on some more flexibility?
I think flexibility will maintain, but we will be reaching some sort of steady state in any case. I mean, we can't continue just being on this alert situation the whole time. And I'm a very positive person, so I'm looking forward to seeing everybody in Lisbon, yes.
It's great. Is there, apart from the whole COVID pandemic situation, are there other future directives that you have in mind for ESCMID to proceed in your years as president that you can share with us already? Or is that asking too much?
Still asking a bit too much because we've been so immersed in COVID, but definitely also taking up the problem of antibiotic resistance will be one of the topics. Yeah. And that is actually part of the whole One Health initiative, which I think once we've sort of survived COVID or are in the steady state, I think it will be important to take that a step further. And also I think looking into on the professional affairs side, equity and diversity of our members and how we can further strengthen those liaisons will be very important. Yes. Definitely. Yeah.
So for the rest of this ECCMID, we're halfway through, unfortunately, already. Are you looking forward to some new sessions you will be following, or will you be spending more of your time meeting up with people, either digitally or live?
Well, I'm definitely looking forward to more sessions, and I think it worked really well, this virtual format. We had beautiful sessions. I mean, I'm a bit biased. There's one session tomorrow on chronicity of bacterial infections, which I'll be being part of with Andreas Bechel. So I think also understanding these difficult to treat infections is something, especially since we are implanting more into our aging population, which will be a problem. So I'll be part of that session. And then there will be other sessions on antimicrobial resistances, which I'm looking forward to very much. Yes.
So you have a good day and a half ahead of you. Okay. Yes. Well, is there anything else you would like to share for now with our viewers? Or
Stay positive, stay healthy, and take care. Many thanks for attending, and I'm looking forward to seeing all of you next year live.
Couldn't have said it better. Well, thank you so much, Annelies, for coming in today in our studio to share with us a little bit of your reflections on the current situation and a little bit with the eyes open to the future. For our viewers, we will be rounding up this interview for now, but we will be back at 11 a.m. sharp on the clock, and we have a great surprise for you then, because we will be meeting with Dan Simpson, who is a slam poet. And if you do not know what slam poetry is, that's just more reason to tune in at 11 a.m. And if you know what it is, then I don't really have to convince you to tune in at 11 a.m. because you will be most likely enthusiastic to come and see what this is all about. So hope to see you at 11. Till then.